The next young investigator I want to introduce is Patrícia Henriques. She's a PhD student at Hovione and at the Faculty of Pharmacy of the University of Coimbra, and a scientist in the formulation development team of the Inhalation and Advanced Drug Delivery Group at Hovione R&D. And she will present part of her doctoral research to us, which is focused on nasal powder delivery and the relationship between particle engineering and in vitro and in vivo performance. So over to you.
Thank you so much for the kind presentation. Hello, everyone. My name is Patrícia, and I'm very happy to be here. It's a really great honor because 4 years ago, I was there starting as a PhD student right in the beginning. And now after 4 years, I'm here presenting a little bit of my PhD. And today, this subject is called Amorphous spray-dried microparticles for nasal delivery, tackling solubility challenges while targeting systemic nasal absorption. So let's start to talk a little bit about nasal cavity. I mean, why the nasal cavity and why not the lungs? Well, the nasal cavity is also very interesting. We have large absorption area, we have high vascularization and permeability, and this allows a fast and direct systemic absorption. And this is especially relevant for drugs that require fast onset of action, for example, for pain management. And the area where this occurs mainly is the turbinates region of the nasal cavity. Also, it is non-invasive, so comparing to intramuscular or intravenous, it is very advantageous. But for every research that we do, we need a challenge. What was our challenge here? How can we deliver poorly soluble drugs to the nasal cavity and have systemic absorption? Because in the last decade, the number of poorly soluble drugs has significantly increased. It corresponds to more than 75% of drugs in the development pipeline, more than 40% of marketed drugs. So these drugs are challenging. We need a way to deliver them. So we thought, how can we boost absorption of these special drugs? Firstly, we can use powder formulations because they are more mucoadhesive. They can stay longer in the nasal cavity than liquids. Also, they allow higher doses of drug. Then we can use solubility enhancement strategies. One of them, amorphous solid dispersions. And here there's an interesting aspect. We can use polymers as dual function, so increasing solubility and also mucoadhesiveness. And thirdly, we can target our area of interest, which is the turbinates. So our thought was maybe spray drying could be an enabler technology because we can produce powders and it's a scalable technology. We can generate amorphous solid dispersions with particle size control, which is important for targeting. So the main objective of this study was to understand if amorphous spray-dried microparticles could be advantageous for systemic absorption through the nasal cavity. And more specifically, we wanted to characterize dissolution and drug release performance of these particles. We used a model poorly soluble drug, piroxicam, two different polymers as well to understand the impact of formulation and compare with physical blends with crystalline API mixed with the polymer knit particles. We also got our lead formulation and understood if we could really have the targeting through the turbinates region. So we characterized that formulation using the Alberta idealized nasal inlet. So briefly, we produced in total 4 formulations, 2 by spray drying, and we used an ultrasonic nozzle to obtain large particles between 10 to 45 micron. So 2 different polymers, as I said, PVPVA or HPMC, 20% drug load of piroxicam, and we also did the corresponding physical blends using a turbula mixer. We characterized these 4 formulations regarding particle size, morphology, and X-ray powder diffraction. And then we conducted dissolution and drug release studies. So we basically used 2 different methodologies. So dissolution using small vessel dissolution apparatus. We put 20 milligrams of powder inside, 20 milliliters of simulated nasal fluid, which is basically a buffer that is similar in salt composition of our simulated nasal fluid, and assessed the dissolution of our powders for 6 hours. And then the second methodology, a more biorelevant one, because we have we used Friends diffusion cells where we have the donor and we put our 5 milligrams of powder in donor, and this really simulates more the humid conditions of the nasal cavity because the powder can slowly hydrate, also using a biorelevant temperature and pH of the medium. And we also did this test during 6 hours. So with our lead formulation here, we did nasal deposition studies using the Alberta idealized nasal inlet, the ANI, coupled with fast screening impactor. And we also wanted to understand a little bit the impact of the variables of the methodology, namely the angle of actuation and inhalation flow rate. So let's now see some results. Firstly, physicochemical characterization. Our particles look like this. They're different, of course. We use different polymers, so we were expecting different morphologies. However, our DV50 particle size is within the expected for spray-dried microparticles, so within 10 to 45 micron. And our blends, they also look how we were expecting, the polymer particles with the API smaller particles mixed. X-ray powder diffraction confirmed that our spray-dried microparticles were amorphous. We are also, obviously, the blends show the characteristic peaks of the drug. And dissolution and drug release studies, you can see here the first methodology that I mentioned, so using small vessels, dissolution vessels. You can see the graph on the right. The spray-dried microparticles, which are represented in the dashed lines, have supersaturation occurred right in the beginning of the dissolution. So in the first five minutes, we see very high concentrations. The solubility of this API in this medium is around 26 microgram per milliliter. So we could obtain here around 130 microgram per milliliter in the first 5 minutes. However, obviously, this state is transient, so we have recrystallization of the drug. However, for HPMC formulation, the blue one, the state was more consistent, so we could maintain the supersaturation for longer in solution. Then we conducted our drug release experiments using Franz diffusion cells, and we can see that the ranking is quite similar. So we see that the spray-dried microparticles have higher profiles. However, for the PVPVA formulation, this was only valid for the first 3 hours of the test, while for HPMC particles, this was valid throughout the 6 hours of the test. So what happens here is that we have a supersaturation occurring in this donor chamber, and this is really critical to have our drug release throughout time. So HPMC can sustain more the supersaturated state of the drug, which allows higher drug release. We can also take some conclusions on the methods. So the first one was really helpful to characterize the spring and parachute behavior and also to rank our formulations, while the second one was a more biorelevant that we expect is more similar to what happens really in our nasal cavity, mimicking our physiological conditions. So based on this, let me just go back. We selected the spray-dried microparticles of HPMC because it showed great results in terms of drug release compared to the others. So we selected this formulation to go through to nasal deposition studies. And as I mentioned, we evaluated 2 method variables, so the angle of actuation, 45 or 70 degree angle, and the inhalation flow rates, 7.5 or 15 liter per minute. And firstly, when we look into the degree angle, so 45 or 70 degree, we can see mainly the difference here is the deposition in the vestibule and turbinates. So the upper graphs, we see there's a high deposition on turbinates and lower on the vestibule, while in the lower graphs, you see the vestibule with a much higher deposition. So if we are aiming at the turbinates region, so aiming at systemic absorption, we should opt for lower angles. And this is in accordance with the literature. We're using other devices as well. Then, when we compare the 2 inhalation flow rates, we can see that the main difference is in the mass balance. So when using higher flow rates, we have higher suitability of the methodology. And this is highly because of our device tip. It's very large. We can't enter the device tip on the ANI. So when we don't apply inhalation flow rate, we see a lot of powder losses. So based on this, we would select a 15 liter per minute and 45 degree angle for this combination of device and powder. And actually for our lead formulation, the HPMC spray-dried microparticles, we have around 55% deposition on the turbinates area, which is very good, which evidences that spray-dried microparticles can be really promising as a particle engineering strategy for nasal systemic delivery. Besides, we only obtain around 4.8% on the pre-separator and FSI filter, which suggests also low potential to reach the deep lungs, which is not what we want, contrary to all the talks we've been having so far. We really want things in the lungs, not here. We really want it to stay only on the nasal cavity. So, as conclusions, we've seen that spray-dried amorphous solid dispersions really present some advantages regarding drug release on nasal powders. And here the polymer plays a critical role on supersaturation. Specifically in this work, HPMC was able to sustain supersaturation for a longer time. Additionally, our optimized formulation showed high turbinate deposition with our optimized conditions of our method. So due to the superior drug release performance and also high turbinate deposition, we would choose this formulation for further performance studies. And now let's go back to the question initially. Is spray drying an enabler technology? So overall, the results really support that spray drying may boost systemic absorption of poorly soluble drugs with targeted systemic delivery and enhanced solubility for poorly soluble drugs. So we could obtain powders with solubility enhancements and turbinate targeting. Moreover, also looking at the methodologies, we can also see that the combined performance evaluation using dissolution, drug release, and deposition studies could be optimal to help and characterize, select our lead formulation candidates. And that's all. Thank you so much for your attention. I'll be happy to answer questions.